Hello, my name is Adrian Richards and today I'm going to be talking about breast reduction surgery. Now this is a very fulfilling type of surgery because people with very large breasts often have a number of problems due to the weight of the breasts. I mean, these can vary from poor posture, difficulty in getting clothes, neck ache. Often they have very heavy grooves where the bra digs in. They can also get inflammation, impetigo it's called, skin inflammation in the fold underneath the breast where the two skin sides are running together. So, breast reduction very satisfying. Patients feel a lot better after the operation. And many patients I sort of see, do consider it probably the best thing they ever did because they don't realise, that they are carrying this, almost 2 bags of sugar around the front of their chest all the time, and they can't believe the sort of the increased movement and the improvement in posture following the operation. Okay, so breast reduction surgery, very satisfying. There are different approaches to it. Basically the approaches are to do with the pattern of skin excision and the way the nipple is kept connected. So the old-fashioned way of maintaining blood supply to the nipple was actually to remove the nipple and replace it as a skin graft, and that's a technique known as free nipple grafting. Now that isn't done very often nowadays, and the reason for that is that the nipple doesn't look very aesthetic afterwards and that you lose sensation and the ability to breastfeed following the operation. So free nipple grafting now is an older historical technique, and nowadays is only really used for people with very, very big breasts, say a reduction of over 2 kilograms per side. So nowadays we tend to preserve nipple blood supply and where we can nipple sensation. And we do this by keeping the nipple attached by a bridge of tissue to the underlying chest wall. And essentially the bridge of tissue can have a lot of different patterns, but is usually either inferiorly based, that means it's a bridge running from the bottom, or my preferred technique is a superior medial pedicle, which is based this way, facing inwards. And the reason for that is you maintain volume in the upper part of the breast, give a better shape, and also preserve sensation better to the nipple. Okay, so it's worthwhile talking to your surgeon about the type of nipple pedicle, the bridge of breast tissue preserving the blood supply and nerves is called the pedicle, and it's worthwhile having a little bit of information, a little bit of knowledge about the different types of pedicle. The second thing you need to think about is the pattern of skin excision. And breast reduction surgery, it always involves a scar around the nipple at the junction of the brown area, the areola of the nipple, and the surrounding skin. So often patients with big breasts will have big areolas, and the areola is usually reduced during surgery. So there will always be a scar around the junction of the areola. There will always be a scar downwards to the inframammary fold. And if you're having a vertical pattern of breast reduction, that's the limit of the scarring. Some surgeons will do a more traditional anchor type breast reduction where you have the lollipop incision around the nipple, downwards, and then along the fold. And that's normally used for people with bigger bust and a bigger reduction. So essentially, how do you choose the type of surgery? Know a little bit about the pedicle, probably veer away from anyone who's suggesting the free nipple graft unless you're really very large busted. Think a little about the pedicle, ask about the pedicles, ask about the likelihood of nipple sensation being maintained, ask about the scarring, ask to see some photographs of patients who the surgeon has treated previously for breast reduction, and where possible, ask the surgeon if you can talk to some of his previous patients. The other important thing to say, that if you are having the surgery, if you're over 40, it's probably best to have a mammogram prior to surgery, certainly over the age of 50, because this will show any abnormalities which can be dealt with at the time of surgery. So breast reduction, very good operation to have, very satisfying for patient and surgeon, but there's a few basics you need to know, and I hope this has helped.